if there's any, and I think this one would also let you know the several initiative in the health sector. Now, there is the National Health Insurance Authority. The National Health Insurance Authority is a special scheme. I would not say a scheme, actually. It's a program that has come to repeal the National Health Insurance Scheme, and it's a promulgation of the law. Under this National Health Insurance Authority is to ensure that Nigerians enjoy comprehensive health. No matter your status, no matter who you are, whether you're in the village, whether you're working or you're not working, the National Health Insurance Authority has come to ensure that people enjoy health. So out of the pocket payment of health will be a thing of the past. And there's no reason why any Nigerian should suffer as a result of absence of health. However, since about a year ago, where the National Health Insurance Authority has come on board, several Nigerians don't even know about it. Some people are not tapping into the opportunities provided by the National Health Insurance Authority. I have with me in the studio this morning some gentlemen, three of them actually, who will be talking to us about the National Health Insurance Authority. Dr. Bob Manuel Somiari is the Standard Quality Assurance Unit of the National Health Insurance Authority. Dr. Bob Manuel, good morning.
Good morning, listeners.
And thank you so much. Mr. Wegbun Franklin is of the Program Unit, National Health Insurance Authority. Good morning, sir.
Morning, listeners.
Mr. Itodo Christopher is the River State Coordinator, National Health Insurance Authority. Good morning, sir.
Good morning, listeners.
Fantastic. So, gentlemen, we will try to talk as much as possible. You know, when I came across that law that repealed the National Health Insurance Scheme and brought on board the National Health Insurance Authority, I was excited because I felt, yes, now what Professor Olukoya, I think Olukoya then the former, what he was Minister for Health, long time ago, what he was canvassing for can actually come to limelight. But again, it is surprising, particularly here in River State, that a lot of people don't even know about it. Let me begin with you, Dr. Bob Mano. In a nutshell, tell us, what is the National Health Insurance Authority? What has it come to do? And how effective are you in River State, in the local community? Again, I know that you're working with the National Orientation Agency, but again, how deep is your work with the local government chairman?
Good morning, listeners. Once again, thank you very much. The National Health Insurance Authority, NHIA, that's the acronym. The main objective of this authority is to provide accessible, qualitative, and affordable health to all Nigerians, irrespective of your political, tribal, or whatever sentiments. And we've gone a long way in achieving this. Like you said rightly, we've partnered with sister agencies like the National Orientation Agency to bring this news to all Nigerians. And the package for this program is robust. You can access health wherever you are, all over the country. And it is a good thing that previously it was called NHIS, National Health Insurance Scheme, which was not mandatory. But right now, it is NHIA. And someone will be wondering why the change. An act was enacted by the former President General Muhammadu Buhari, and that act made health insurance mandatory. And the mandatoriness of that act made us move from a scheme to authority. So soon, and very soon, my dear Nigerians, health insurance would not be optional. Every Nigerian must have one form of health cover. And you were talking about how deep have we gone. Now, because of the peculiarities of our environment in Nigeria, there are some places, the nook and crannies, how far have we gone? We have several programs. And let us also not forget the NHIA regulates all other insurance programs. Let me talk about the state social health insurance programs in this aspect. The state social health insurance programs will cover indigents and residents of their states. The River State package is just coming on board. So they will go to these nook and crannies under our supervision and get people enrolled. And all these activities is just to attain what universal health coverage. That is the ultimate aim of this activity.
You know, I want the state coordinator to talk a little bit here. Mr. Itodo Christopher, I want you to talk a little bit because you see, when I listen to Professor Mohamedou Sambo, who is the Director General of the National Health Insurance Authority, I was excited to the extent that Professor Sambo said that they've even constituted what they call COMO, community something, to drive it down to the community people. And he said the essence is to ensure that no Nigerian, irrespective of your status, irrespective of whether you are a civil servant or not, you should be denied healthcare. But again, here in River State, we still see some people not enjoying this. Why?
Yeah, thank you. That is a very good question. In River State, like you mentioned, you will recall that as part of Professor Sambo's dreams and vision for this National Health Insurance Authority, he encouraged what we call health insurance under one roof, whereby state government will also bring on board what we call the state social health insurance agencies. As part of effort by the federal government, they have also moved ahead to enact a law which brought about the National Health Act. And under that National Health Act, there is a provision for access to minimum package of health for all Nigerians in all the states of the Federation. But for every state to access that fund, that state must first of all establish the state health insurance agency.
Is it in River State? Do we have the
state? But for us here in River State, River State is the only state in Nigeria that does not have that state health insurance agency in place.
You know why? Hold on, because this is a very serious case for us. Again, River State cannot be considered to be backward, because I saw that article where they said River State is only state in Nigeria, and I was waiting to clarify that has not established this state health insurance agency. Because the state health insurance agency will allow the people in River State to key in into what the National Health Insurance Authority is providing, which has denied. Go ahead.
Yes, as it is now, the federal government, in spite of the fact that River State had not put in place their state health insurance agency, has also made provision for that care through the National Health Insurance Agency, gateway, that funds that is meant for River State. But because it's a prerequisite for the state to establish the state health insurance agency, that fund is lying fallow in the bank. The state cannot use it. You understand? So we have been talking to the River State government,
and on our part,
on
our part, we will invite the Commissioner for Health. Because other states, I'm aware, other states are already benefiting from provision of the National Health Insurance Authority. It is created by law. It is, and there are a lot of things that it should benefit. One of the maybe you, Dr. Itodo, did not. Dr. Bob Mano did not explain it very well, because under this National Health Insurance Authority, the poorest of the poor should enjoy healthcare.
That is where we are talking about basic healthcare provision fund. This basic healthcare provision fund made provisions for people, the indigent, the vulnerable group, to access care from the primary level. You understand? Because government consider the primary health centers as the most critical aspect of healthcare services to Nigerians. And through the National Health Insurance Gateway, they have made that provision. They have also made provision through the National Primary Healthcare Development Agency to enable these primary healthcare centers also provide personnel, equipment for these services. At that level, they may be utilizing their funds. But at the level of buying the services, paying for the services, which is through the National Health Insurance Gateway, they cannot access it until the state health insurance agency is in place.
You know, this is very sad, Because you see, in a state like in Akwa Ibom State, Uyo,
Bayelsa,
Bayelsa, they
Delta.
are already. In fact, there was a training in Uyo, I think 2 weeks ago,
Yes.
where they were training the people on how to sensitize the people more,
exactly,
and to show the people the provisions, what is available under the scheme.
Exactly.
But here in River State, even the primary thing we've not done.
Exactly.
But what are the dangers of this?
That's where you have a high mortality rate around the place. You understand? Maternal and child mortality is high because people who ordinarily do not have what it takes to access care in hospitals, who would have been helped by this provision, have also been denied that opportunity because of the refusal of government to put in place the State Health Insurance Agency. One of the things we have demanded from the state government is the fact that the last administration has been able to sign into law the State Health Insurance Agency Act, just to appoint a chief executive who will drive the process, who NHIA will interface with, as to this is the person who is driving this process in the state. That is where we are. To appoint somebody to drive the process is difficult for the state government. And without this, we cannot go anywhere.
I'll come back to you, the River State coordinator of the National Health Insurance Authority. If you're listening to us, this is Pointblank. And if you just tune in, you're listening to this very important part. And this has to do with the National Health Insurance Authority. The National Health Insurance Scheme has been repealed, as it's no longer in effect. It is replaced by law by the National Health Insurance Authority. And one key idea of the National Health Insurance Scheme is to ensure that Nigerians, irrespective of their status, health insurance is mandatory for all Nigerians, even at the community level, at the grassroots level. It means that you can now enjoy affordable quality health care, regardless of your economic status, and that insurance is not only for civil servants, but for people in the informal sector as well.
Yes.
So it makes a comprehensive access. However, there is a challenge in River State. In River State, this has not worked as it is working in other states, because River State does not have the River State Health Insurance Agency.
Yes.
Until the River State Health Insurance Agency comes on stream, we may not enjoy the packages available. Not that there is no money, there is money.
Yes, sir. Yes, the funds are there.
Yeah.
Federal government had provided the funds. But the problem we have right now is the refusal of the River State government to put in place the agency.
Okay, let me come to Mr. Franklin. Mr. Franklin, tell us programs that are available under the National Health Insurance Authority. Under this, what are the things that the people can enjoy if tomorrow River State government wakes up and comes and do what they ought to do?
Okay. Actually, the National Health Insurance Authority, the former NHIS, during conception, a lot of programs were actually designed to ensure that every Nigerians have access to qualitative and affordable healthcare. In the course of that, programs like the gift sheet program, the former sector program actually covers those who are in the federal civil service, the organized private sectors and all that. Then we have another program we call the gift sheet program. The gift sheet program is designed specifically for the informal sector of the Nigerian economy. The benefit of this program is that once a group of persons, families, and individuals come program. The only challenge we have is that we do not have a functional state social health insurance program in the state because of the failure of the state government to set up the agency.
Okay.
So there are other programs. The benefit of this program is that an individual who doesn't have to pay out of pocket. You just walk into that hospital
because the insurance has covered.
It has been covered. You just have access to health care. The only payment you are expected to make at the point of collecting your drugs is what we call the co-payment. co-payment is just 10% of the total cost of drugs you are given.
Okay. I'm very sorry, because I just want us to take some calls. And I also would like to know, maybe from Dr. Bob Mano and the state officer, collaborations that you're making with health institutions. And I also know that you're working with the Pharmaceutical Society along some line.
Yeah.
I would like to know more about that. But again, let's open the telephone line 07050791021 and 0811743101. We're talking healthcare. And again, the National Health Authority is the National Health Insurance Authority is in the studio. Yes, the scheme is running in some state, but it is hampered a little bit in River State because River State has not set up the River State Health Insurance Agency. So again, that's what we're talking about. I'm just going to take 2 calls. After that, I'll come back to the studio talking to the gentleman in the studio. So you want to find out about this Health Insurance Authority, what it is all about, how you can benefit. Maybe you are in the informal sector. How can this cover you in the informal sector? We'll just talk about that. If you have a call, let's just take this call. Hello, good morning, and thank you for joining us. This is Pointblank. Good morning. Okay, so we come back to the call. So let's talk about the partnership now. How are you partnering with medical outfits to achieve the success? I know, yes, in River State, you still have 1 or 2 things. Dr. Bob Mano.
Okay, thank you. Now, in terms of partnership with health institutions, I'll take it from the hospital angle and the pharmaceutical bodies. Let me start from the hospitals. Healthcare delivery under the National Health Insurance Authority is at 3 levels of care: the primary level, the secondary level, and the tertiary level of care. The primary level of care is a point of entry into the health system. This has to do with the OPDs.
Dr. Bob, I beg your pardon. I've just been told that we have a call on the line.
Okay,
let's just take this call.
Okay,
hello, good morning, and thank you for joining us. This is Point Blank. Hello. So we lost the call. Yes, go ahead.
Okay, I was talking about the levels of care. We have the primary level of care, the secondary level of care, and the tertiary level of care. For the primary level of care, that is your point of entry into the health system. This has to do with the primary health care centers, the OPDs of tertiary institutions. So for all primary health care centers, we try to accredit them through the state health insurance agencies. That is why it is important that they come on board so that these primary health care centers can be fully on board. That is the first level. Then for every ailment or disease that cannot be handled at the primary level, we go to what the secondary level of care. This is where we have most private hospitals in Port Harcourt. We do something called an accreditation exercise. We visit these facilities and look at them based on set standards, level and quality and strength of staffs in terms of their qualifications. We look at your environment, we look at your waste disposal systems, we look at your quality of care, we look at so many factors that we look at before we can accredit you. That is the secondary level of care. Mostly the private hospitals are on board. And for you to have a secondary level of care, we are talking about what specialist care. Anything that will make you see a specialist, we've already left the primary level of care. So we interface with facilities at that level. Now for the tertiary level, and this has been a very good winning point for the NHIA. We in River State, let us focus on River State. In River State, at that level, we have UPTH, the University of Port Harcourt Teaching Hospital. We have a robust partnership with UPTH. My boss here talked about the gift ship program. Let us also inform you at this point that UPTH plays a very crucial role in our gift ship drive. And this gift ship also covers core members. Most of the core members at any level that care cannot be given, they are referred to what UPTH. The BMH, formerly BMH, now RSUT, University Teaching Hospital, is also a key partner with the NHIA in terms of referral services. They also provide primary services at their OPD level, that's the outpatient department level. The military hospital too cannot be overemphasized. Their role and their partnership with us cannot be overemphasized. We have had several enrollees, or our patients and clients in this case, have different types of surgeries at the military hospital on our bar road. That is our level of partnership at the level of hospital. Now let me go to the pharmaceutical aspect. I'll talk about 2 things quickly. The NHIA Roche partnership. One of the menace in society today is cancer. And the authority thought it wise to have a partnership with Roche to cater for what? Cancer drugs. Now, what is the partnership? The partnership says NHIA, Roche, and the enrollee will do what? Payment together in a ratio of 50 to 30 to 20. That is the payment structure. And now there are 7 pilot centers in Nigeria, test centers for this NHIA Roach partnership. And let us not forget that the number 1 killer of women in terms of malignancies is what? The breast cancer. And it is well covered by Roach and the NHIA. The pilot centers, we have the National Hospital in Abuja. And let me quickly say, before I go further, these centers are based on what the geographical regions of Nigeria, one per geographical zone, but it will still cut across everywhere in Nigeria. But for now, in that north central area, we have the National Hospital in Abuja. For south side, we have University of Benin. So any woman, for example, that has a breast cancer issue that wants to benefit, it's in UBTH, University of Benin Teaching Hospital. Then for the southeast, we have Nsukka, that's in Enugu State there. University of Nigeria Teaching Hospital is Nsukka. Then for the southwest, we have University of Ibadan, that is in Oyo State. Then for the northwest, that's the Kano axis, you have this Aminu Kano Teaching Hospital. Then the one that covers the northwest, that's the Kaduna axis, we have Ahmadu Bello. All those areas are the ones piloting this activity for now. Then one of the challenges and one of the bottlenecks that has plagued health insurance in Nigeria in terms of access is what we call out of stock for drugs. And the authority has battled this head-on. What did the authority do? Now there's an NHIA medicine initiative. What is the partnership? We've partnered with big pharmaceutical companies to brand NHIA drugs. There has been this false misconception that NHIA drugs are substandard. People want to be giving branded drugs. People want Jogmentins. People want Urosefins. But NHIA is saying no, the generics are as efficacious as these branded drugs. So now we brand our own drugs. We'll go to these companies that are making Augmentin, for example, we'll go to them, give us that quality, but brand NHIA on the logo. This is just to, what is the objective of this? To improve the confidence of the enrollees in the quality of drugs they are giving. And it's also to battle this out of stock syndrome in pharmacies. I think for the pharmaceutical companies, that's what we've been able to do.
Fantastic.
Thank you.
This is Point Blank, and we're talking to members of the Nigeria Health Insurance Authority here in River State. It's a very important authority. It has come to replace Nigeria Health Insurance Scheme in ensuring affordable and accessible healthcare to Nigerians. All Nigerians should enjoy healthcare, and you should have healthcare delivered to you at a less expensive way under the insurance. So the issue of paying out of your pocket is a thing of the past. No one should die because you cannot afford healthcare in Nigeria. And again, River State has this challenge, which we have talked about. One of the challenges in River State is the absence of the River State Health Insurance Agency, which we have talked about. But again, State Officer, this challenge notwithstanding, there is still dearth of information. People don't know. What are you doing? We just have about 5 minutes.
That's why we're here.
Yeah.
We have realized that there is dearth of information. People don't hear. We try to embark on what we call roadshow, where we have routine, regular marketing on the road.
But do you have
Talking
this
to
campaign
people,
in the languages of the people? Have you domiciled it in their languages?
Yes. We have also created jingles
Okay.
in the languages of the locals.
Maybe you need to partner with radio station and TV stations to have all of this on these talk shows, because this is important.
We are doing all that.
Okay.
It's one of the reasons why we choose you.
Okay.
We have realized that you have a large audience and that people can hear us from here. That is why we have come. We also intend to discuss with you further on how to place jingles in your station, whereby people can listen to it and know what we are talking about. Because right now, the strategy we have put in place in River State, because we don't want anybody to die, we have come up with a gift strategy, leaving no one behind, so that people can access care through the gift. With just 15,000 naira, they can come together. 2-3 persons can come together with 15,000 naira. That is 45,000. They pay to the NHIA. They get registered. They get access to care at primary, secondary, tertiary level. You understand? For a year, renewable every year. And with that, you walk to hospital, get treated, and walk home without paying a dime. You don't need to go and sell land for you to get treated in hospital. Globally, what is obtainable now is health insurance because people have realized that pay out of pocket payment, of course, has put family in a very precarious situation. And that is why we are talking to the River State people to come to the NHIA office where they can obtain.
Where is the NHIA office? Let's start from there first.
The NHIA office is at number 4 Dividena Estate, opposite NDLEA.
Okay.
Aba Road, Rumogba in Port Harcourt here. So anybody that comes into that office can always access care via this GISHIP program. You don't need to be working with the federal government or with the state government or with a company. As long as you can come into the NHIA office and you pay this token, you'll be given what we call the NHIS number, which will enable you to access care in your hospital of choice. And with that, we believe that people will be able to overcome.
Mr. Itodo, I know you have one thing more you want to say. One thing I can assure you is we will definitely continue this conversation. Because let's leave the challenges. Let's leave what the state government is not doing. But let us look at what the people can enjoy now.
That is why we came up with the GISHIP strategy.
Yes.
Because we have been talking to the state government. And the level we are now, we felt that there is no need to continue that conversation. Rather, we should do something that will make the people to access care. Just yesterday, because through this week, we observe what we call the customer service week.
Okay. And
we were talking to our enrollees to get feedback. And yesterday, in one of the hospitals where we went to, Pamo Hospital along Aba Road, an enrollee caught us up there yesterday and was very happy, telling us how she gave birth through CS in Pamo Hospital without paying a dime. That if not until she had that experience, she never knew such a thing can happen in Nigeria. That it was just yesterday.
The long and short of this story is Rivers people can enjoy health care very cheap without paying out of their pockets.
Out of their pocket.
There is a plan by federal government. Other states are enjoying it. And that is what this gospel is all about. But again, definitely we will bring you back. Mr. Itodo and your team will bring you back on all of our other programs because you see people dying of malaria. They need not to die.
Yes.
People are begging around, selling their land, selling their property just to take care of health. They need not do that.
No.
And the reason why we're having that, particularly in the rural community, is absence of information. Yeah, we know government has an issue. We will leave that alone. But what is available to the people, we need to let them know.
Yeah.
And so, any last word?
Yeah, the last word that we have for the people is to embrace the NHIA GISHIP program so that they will not die or sell their land for them to be able to get treated in hospitals.
Fantastic. Well, the telephone lines are blinking, but unfortunately, we don't have time to take that. But we will definitely bring you back. So we will have the team from the National Health Insurance Authority come back again. And maybe that time we'll be speaking in Pidgin.
Okay.
So that the people can understand it.
We can also give our call center.
Yes, please give the phone numbers.
0916 27 34 706. I call it again. 0916 27 34 706.
So again, I'm going to ask him to call the number again. If you have any question, you need clarification how you can benefit, call the number again.
09 16 27 34 706.
So there you have it. That's the line for the National Health Insurance Authority. And again, don't get it wrong. It's a federal government thing.
Yes.
It is a federal government thing. It is not a private sector thing. It is a federal government thing. So you don't need to be afraid that somebody wants to collect your money.
No.
It is not collecting your money. It's a federal government thing. And the funds are there, working in partnership with some other international organization. Once again, I must thank you sincerely, Dr. Bob Manuel Somiari, Mr. Wellboom Franklin, and Mr. Itodo Christopher. Thank you so much.
Thank you.
And that's it on Point Blank this Saturday. We do hope you enjoyed this package. Be part of the edition next week as we bring to you another set of guests. Good morning.
Super FM.
Oh yes, our people talk say na delay dey make fowl no fit fly like other bird in meat. Oya now, rush now, carry your jingle, announcement, religious program, political program plus many more. Go Super 93.3 FM Port Harcourt. As a big man concern, call our marketing sales rep on 0915 729 0709 0915 729 0709. Super 93.3 FM Port Harcourt. Your satisfaction, our guarantee.
Everyone, quickly gather around. We've got a big announcement.
Now this one, it's not just for the kids. This one's for the whole family. Parents, uncles, aunties, everyone.
Parents, now remember all those dancing competitions you lost as a kid?
Yeah, those epic showdowns on the dance floor.
Well, guess what? It's time to redeem yourself.
Get ready to groove and move at the Super Family Fun Fair.
We've got dancing competitions for moms and dads.
And it's not just dancing, no. There'll be table tennis games for those competitive spirits.
Horseback rides for the adventurers.
Bouncing castles that'll make you feel like a kid again.
Foosball for some intense family rivalry.
And that's just the beginning.
So parents, uncles, aunties, bring your A game because this fun fair is for everyone.
Tell me, what better way is there to make memories with your loved ones this Christmas season than at the Super Family Fun Fair?
Mark your calendars for December 14th and 15th at the Hakuna Matata theme park.
It's an event you don't want to miss.
Get ready to dance, compete, and have a blast with your family.
Venue is Hakuna Matata theme park,
a subsidiary of Eco Hotel and Suite,
Eco Atlantic City, Amado Bello Way, Victoria Island, Lagos. We cannot wait to see you.